Started with our PHEP BP4 grant duty reporting, and Greg is going to start the recording. We'll get going. Okay, so I'm Mickey Scullard. I work in the Division of Emergency Preparedness and Response, and I'll be one of your presenters today. And Sean Wang is our CDC Public Health Associate, and he will be helping us review the Red Cap report. Next slide, please. All right. Our land acknowledgement is every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes in hope of a better life, and some have lived on this land for more generations than can be counted. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We are standing on the ancestral lands of the Dakota people. We want to acknowledge the Dakota, the Ojibwe, the Ho-Chunk, and the other nations of people who also call this place home. We pay respects to their elders past and present. Please take a moment to consider the treaties made by the tribal nations that entitle non-Native people to live and work on traditional Native lands. Consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. Please join us in uncovering such truths at any and all public events. Next slide, please. So today we're on the second of the training sessions offered. It's a repeat of yesterday, so if you attended yesterday, you don't need to attend today, but you're welcome to. We are recording this, and it will be posted after we have made it accessible. It'll be posted on SharePoint under Duties and Supporting Documents. Next slide, please. So our agenda today is we'll do a quick Red Cap review. We know that many of you are very old hands at this now, especially after COVID, but we may have a few new people. We'll go over the BP4 grant duty reporting in Red Cap, and then we'll see what questions you have. Next slide, please. Okay, for those of you who have access to Red Cap, please feel free to log in and follow along. If you're new to Red Cap, you do need to get a username and password. So you can check with your PHPC on getting a request put in. Just as a heads up for those of you who are new and a reminder, your username is your email address. However, Red Cap replaces the @ symbol with a period for your username. That's probably the biggest technical problem we all have. For assistance in troubleshooting, contact Toby McAdams for logging in problems. Contact your PHPC for orientation to using Red Cap if you're new, and for all of you for content questions, talk to your PHPC. Next slide, please. So some key words in Red Cap, because every technology has its own way of referring to things. A project is a group of one or more forms in which you enter your data. You may have access to multiple projects from many different programs at MDH, or you may have only the project associated with PHEP. And for those of you who've been around a while, you may have several PHEP projects. It goes back to BP1. Instruments and forms are where you enter your data and your information. We use those two words kind of interchangeably. Branching logic is where when you answer a question one way, it determines if some more boxes should open up or if you're done. So it really depends on what you answer, and that'll then determine if you have additional questions to answer. And then a repeating instrument is one where you can have additional instruments forms created multiple times. So examples are community engagement and training. So you can enter one training, create a new instrument, then put in a second training. Next slide, please. So logging in and finding your project. So when you log in, you'll come to this landing page. And if you have multiple projects, you may want to go out to My Projects. So in the green box, you see an arrow pointing to My Projects. You click on that. And the next slide, please. It'll bring you to this menu. And then you go through and you check which project you want to be working on. So in this case, what we're referencing is the PHEP BP4 grant duty report. and you'll click on that. And then next slide, please. That'll bring you back to this landing page, but you know you're in the right project to answer the right questions and fill in the right information. You'll click on Record Status Dashboard, outlined here in the green with the orange arrow. So when you click on the Record Status Dashboard, next slide, please, you'll get this view of all of the different instruments along the bottom here, in the yellow row. Yep. And you are only, if you could go back one, please, Joan. Yep, you are only able to see your CHB or tribe. We can see all of you, but you'll only be able to see one. Next slide, please. And so this is a blow up of that yellow row. And so these are the instruments or forms that you need to work through to be complete with your report. As mentioned, that there are no electives this year. All duties are in the instruments themselves. Where there are different expectations for base X, Y, and Z, it actually references that. So in some cases, base does 4, X does 5, Y does 6, Z does 7, something like that. So if there's some variations based on your funding levels, we put those right in the instrument. Most duties are arranged by capability, but there are some exceptions. So you see capability 1 as community preparedness, but capability 2, cope well, is right here. Capability 3 has several duties under it, but we did pull out the AARIP because that's a very, very large, with many, many different entries instrument. And B7, which is the NIMS ICS training implementation timeframe plan. So you'll put that in there. But all the questions under capability 8, 4, and 15 are contained within those capability instruments. We've got our CDC performance measure ones, and then the Minnesota performance measure ones, response and recovery, community engagement. And then we did pull out from the vaccine reporting the questions about PHEP funding used for COVID activities. And so we'll be walking through those shortly. Next slide, please. All right, so we had a few questions yesterday on reporting timeframes. So we have both current grant activities like the NIMS ICS training plan, but we also have several questions that will be asking you to reflect back on COVID-19 response. Just as a reminder, we significantly reduced the grant duties in BP2 and we waived all but one for BP3. So we haven't really asked you a lot about your COVID response experience. So we're asking you this year to reflect back on your COVID responses, to answer select questions about specific areas of response. And your time frame for that may include activities as far back as January 2020 to the present budget period. So these answers could be on things you're doing now, could be on things you did last year or the year before. And while we know many different streams of COVID-19 targeted funding were used for specific activities during the response, PHEP funding provided a broad-based foundation for most of the COVID work. PHEP grant duties that focus on COVID-19 response work and that you will report on target areas and topics that haven't been reported elsewhere. And we're not asking you to write a book for these. We want you to have very succinct answers with enough detail to understand the activity or the learning, but you don't have to write a lot. And then how we use this reported information. I think we all know that much of our future PHEP work will focus on lessons learned during COVID-19 response. Responses are going to contribute to things like building promising and best practices, something that's missing in our field, informing strategic planning and grant duties, development of education and training opportunities, and evaluation of response work from a statewide perspective. Next slide, please. All right, so again, if you have questions on reporting, start with your PHPC, so on the content and things like that. If you have REDCap technical problems, connect with Toby McAdams. And I'll just pause here for a second while we shift presenters to see if anybody has any questions. I should pull the chat up here. So, we all know what's coming, that the snow plows are getting geared up. So be ready, be prepared, watch the news, watch the weather. All right, so now we're going to walk through the red cap report, and Sean's going to make it a bit bigger so we can all see it easily. That looks great, Sean. Maybe just a titch bigger. Thank you. Perfect. Okay. So Sean clicked on our test record from that dashboard view. And so now you get another view of how you can walk through your instruments. So there's a lot of different ways to get to the different forms instruments we have. So let's go ahead and start right off with the recurring duties. Okay. So these should look very familiar to you. There hasn't been a lot of change here. The work plan is not there because really there wasn't anything to really develop a work plan for this year. That may reappear next year. But so you just indicate when you've completed your mid-year report by December 30th, and then your end of year report, which is July 7th. And then we have you update and maintain accounts in Minnesota Response, MinTrain, PartnerLink, which we know is so critical to getting critical information. IMATs, you need to review and update pod and LDN locations and contacts at least every 6 months. And then when appropriate, and if it's something you're using, make sure you maintain your accounts in MinTrack. Then our next recurring duty is the Health Alert Network, which has been well exercised the past couple of years. We need you to respond to health alert messages, alerts in 1 hour, and advisories in 24 hours, and maintain a 2D PON contact list for each hospital and primary clinic within your jurisdiction. You're asked to forward all HON messages sent by MDH to the appropriate healthcare partners as directed in the HON message. An exemption to this duty may be granted for an individual HON message after consultation with MDH staff. So you do need to forward those unless you've gotten an exemption after talking to MDH staff. We need you to maintain appropriate NIMS training based on the roles you've assigned. I know some people would really like us to say what training you should do, but each of you are so different that you set up your ICS much differently. You have different people filling different roles, or you may not fill some roles. So the thing that we ask you to do is to refer to PHEP Capability 3, page 36, as a guide based on the roles that you have determined you're going to be filling during a response. Can you scroll? Yep, there. Thanks, Sean. After action reports, improvement plans, and corrective actions for non-COVID-19 responses and exercises are due 90 days after completion of the exercise incident and event. You document your status or completion of corrective actions and track progress on improvement plans. And then you retain your AARAP documents for planning purposes according to your agency's retention policies. We also have the attend MDH sponsored preparedness trainings when offered and appropriate to your work. So that allows you to use PHEP funds for trainings that fit your jurisdiction's needs, hazards, risks, threats. Maintain that healthcare coalition signed membership, and every region needs a CHB representative on the Healthcare Coalition Steering and Advisory Committee, and that person needs to report back to the directors and emergency preparedness coordinators on actions, information, and other important items. And then finally, the Integrated Preparedness Plan, which was formerly called the MyTAP, Multi-Year Exercise and Training Plan. As you know, we've talked about it'll be shifting, and we think it's shifting this year. And so we are going to offer a virtual orientation introducing the Integrated Preparedness Plan. And I know it won't be occurring before mid-year, so we just put that it'll happen by the end of the year. And so then you check that you've attended that. And we need to refresh our brains and start going and thinking about these jurisdictional risk assessments, which are required to be done every 5 years based on your jurisdiction's timeline cycle. Kind of fell by the wayside for many during the past couple years with COVID response. Totally understandable. But we need to start pulling that back in and getting back on track with getting that done. Some people were due to do it during COVID and weren't able to. So that's something that should be looked at and decided how you're going to get back on track. Kind of reset the clock now. So we ask you to put in the date of your most recent JRA, the date of your next JRA, and then you list the top 3 threats that were identified and what the public health role for those top 3 threats are for each threat. And then we have a box for narrative, which is optional. If you want to provide any kind of explanation or context, you are welcome to do so. Everybody needs to complete at least one volunteer call down drill and the volunteer call down drill AARIP and upload it. And you've got an upload link there. However, this requirement is waived if you activated your volunteers in BP4. So if you are actively using volunteers still or convene them for some reason for a response, you don't have to do the drill and the AAR. And there's a button for you there, not applicable, that you can check. And then finally, our last one is, did you make any equipment or property purchase of $5,000 or more this budget period? The majority of you are going to say no, but we always have a couple who have purchased that. And this is with PHEP funds, not any of the other vaccine or other COVID funds. This is PHEP funds. So if you say yes, then you have to complete this information, and we need you to fill in every line because that is the information CDC requires us to submit to them if they request this, if and when they request this information. So for the very few of you who might say yes, that is really, really important. Well, that's a good question, Tony. So Tony's asking if the JRA needs to be specific to public health or if we can use data from a jurisdictional THIRA, which is a threats, hazards. I can't remember all the pieces for that, but it's a jurisdictional risk assessment. It says very specifically in the PHEP guidance that it doesn't have to be individual like a public health one, but you need to participate to ensure that there's public health, behavioral mental health, and healthcare components included in that THIRA. Otherwise, something like a pan flu or an emerging infectious disease like COVID gets put down as number 20. When pan flu actually might be more like a 2 or a 3 or a 4 hazard. So thank you, Lisa. Threat and hazard identification and risk assessment. So I think that you can't just use something that you haven't been involved in. You need to be involved in that THIRA component or in that JRA. It certainly is stronger when you have many partners at the table. Some of you may participate with Healthcare Coalition's Hazard and Vulnerability Assessment, HBA, and some use that too, if there's some jurisdiction-specific stuff that you're able to have in there. Sure, thanks. All right, Sean, I think that's it on this form, so we'll go to our next one. All right, Capability 1, Community Preparedness. So this, for a lot of these where you have the option to report at the local public health level. So if you're a individual agency of a multi-agency CHB, you still this year have that option to report at that local public health level because either we wrote the duty at that level or the response activities were conducted exclusively really at that local public health level and not the CHB level. So you will select how you're reporting if you're a single county agency, individual county of a multi agency CHB, and that will pull up the drop down list of county agencies. So you're able to select which county you're reporting from. And then we also have multi-county single agency. So like a Countryside or Horizon, just need to click that, and then tribal health has their own button too, and they don't have to select which tribe they are because we know they're reporting for their particular tribe. Then for almost all of these, we ask you what your mid-year progress is. So you'll do that one by December 30th. For not started and off schedule, a box will open up to say, if you haven't started or you're off schedule at mid-year, why? And then for the end of year, either completed for BP4, and we recognize that many things are ongoing, but did you complete your work for BP4 on that particular project, knowing that it'll go multi-years? Or you didn't complete it, and then a box will open up asking you why. And then, and it just needs to be a couple sentences. And then you have the still impacted by COVID-19 option for, for this year. So then capability one's duty is to describe an impactful, innovative, unique, or creative COVID-19 response activity or action. The requirement is just one, but we know that many of you have been very creative, done some very unique things, some innovative things, or some very impactful things. And so we wanted to leave you room to share more than one if you so choose. And so if you say, yes, I'd like to, well, first, before you go to that part, you'll say, would you recommend this activity under other agencies? And either way, if you answer yes or no, a box is going to open up and say, if you said yes, why would you recommend it? If you said no, why wouldn't you recommend it? Because there may be things we did that we wouldn't want to repeat or were very unique to this situation. But those are really important pieces of information to have. And then if you want to report on another one, you say yes, and a series of boxes will open up for you again. And we have this going to 5 times, Sean? Is that right? Up to 5, I believe.
Sorry, I couldn't find the unmute button, but yes, up to 5.
Okay, thank you. So you can report up to 5. And if you want to report more, let us know and we'll help figure out how to do that. But, the requirement is just one. If you are thinking, I'm so exhausted, I can't even think about anything. One of the things I recommended yesterday was maybe have a brainstorming session at our regional meeting or with a couple of other agencies to see, what did we do? I can't even remember now what we did during COVID, but this could be really cool. It doesn't have to be something that's perfect. It doesn't have to be something that's all ironed out. It's something that that you thought was a little bit different, and it may be something that we work on exploring in the next few years to get to that perfect kind of plan. Can I give an example of a creative action? Maybe you did something really interesting with essential services. You partnered with an unexpected partner or had maybe you assigned all of the essential services to the food shelf or worked closely with an extension office to develop meal plans. Maybe there were ways you were able to address culturally specific nutritional needs through essential services requests. So those are some things right off the top of my head around essential services. Maybe there's some unique ways that you communicated with partners or with the public, or you did some sort of listening sessions. I mean, there's just a whole wealth of possible ideas. Does that help, Terry? And it could be impactful too. Maybe you were able to reach a particular community in your jurisdiction and you saw the results of the work you did because 70% of them got vaccinated, or testing. Perhaps you made testing accessible in a way that had never been done before. So there's no right or wrong answer to this. And so I want to emphasize that part. No right or wrong answer. And if you're not sure, talk with your PHPC and they'll say, yeah, a lot of people have done that one, but you had a twist on it. Go ahead and put it in. That's okay. We're not grading these. All right, I think that's it on this one. Let's go to the next one. Okay, cope well, and this will work for those of you who have gotten approval to use a non-Copewell version. Julie and Nancy reviewed that carefully, and in the FAQs, there's actually some question answer about how do you use this for a non-Copewell. Again, you can do this at the local public health level, so we have your options. Tell us how you're reporting this. And then we've got a checklist of what you've completed. So attending the introductory webinar, completing a REDCap survey, which you've all done. So that'll be an easy checkbox. You need to complete an assessment in REDCap by December 31st, and that's just a little bit further down here. You develop and upload an action plan based on the assessment, and we'll show you where you can upload that, where you can find the template and upload it. And then you reassess and identify and document areas of growth no later than June 30th. And so again, completed or not completed. So this is a pilot assessment. So we're going to be looking at how this works or doesn't work for response recovery. So here at the mid-year and end of year, you have your usual where you're at, and then we'll move down to the actual assessment, the social capital and cohesion one. Sean has put in here, if you want to know more about what community with low capacity or medium capacity or optimal capacity looks like, you say yes. And then it opens up with a definition and explanation for all of those. If you answer no, it doesn't open up. But you can't just do a yes. You have to have the yes, no. So the yes will give you a little bit more explanation. So that way you can answer the rating question at mid-year and then at end of year. And then there's a couple boxes for you to explain your rationale for your mid-year rating and then for your end of year rating. Just 2 to 3 sentences. And then next steps. Describe your next action points in 2 to 3 sentences at mid-year and then at end of year. And then you'll repeat that for the community functioning, health and well-being. So it's the same thing. If you want to see more about the different capacity levels in this area, you say yes, gives you good explanation, and that helps you determine your rating at mid-year and then at end of year. And then we'll ask you again your rationale for those ratings at mid-year and end of year, and then your next action points in 2 to 3 sentences at mid-year and end of year. Then the Copewell pilot deliverables. So we ask you again if you've started or not started. And then the actual action template is right here for you. So you can click that, you'll get the blank document. Once you've completed it, you upload it on that link, and then you're done. And then we want you to describe one activity from the Copewell action plan and list any new connections or partnerships from the Copewell action plan. And then finally, I believe this is finally, you are asked to list your first next step from the Copewell action plan and your second next step. And then we do give you the option of sharing additional next steps if you want, up to a couple more, I think, or just one more. And then that's the end of that one. Let's go ahead and move to the next one. All right, capability 3, emergency preparedness. Again, you can report at multiple different levels. The demobilization plan is a duty that is a regional duty. And so you have this discussion at a regional meeting. And then what we want you to do is list, you don't all have to upload this. You designate one reporter for your region, and that person will upload your discussion report here. But we would like each of you to indicate who your reporter is and their jurisdiction, especially if you're not the reporter. So that way we aren't looking for that upload there. And then again, we ask you at mid-year and end of year to indicate your status. And then at the local public health, or actually we say please at the CHB level, to answer these elements of a demo plan, how important are they to you? Either least important or most important, or it's not applicable. for those 4. And then we recognize that you may have identified additional elements, because I think, as we know, there's almost nothing out there for demobilizing a very long response. So this is going to help all of us kind of think through, what should we be thinking about even as we start mobilizing a response that might be a long-term one. How do we start thinking about demobilization? So you are able to fill in additional elements and then rank those also. We couldn't make them go across like the ones above, but it's the same idea. And then we have you describe what these other elements are. So we have up to 3 of those that you're able to do. Then the next set of duties, or the next duty, is about the gaps in corrective actions based on your COVID-19 hot washes. We want you to identify and list gaps in corrective actions by the end of BP4. You're going to review those corrective actions with your PHPC at a site visit or another meeting. And this is one where you do have different expectations based on your funding level. So base and tribal health will report 4. X levels will do 5. Y will do 6 gaps in corrective actions, and Z will do 8. And for local public health, CHBs, a minimum of 2 of the corrective actions selected need to address access and functional needs of at-risk individuals, communities of focus, vulnerable populations. So again, indicate your status at mid-year and end of year. And then here you will start just describing your gaps. You do a gap, and then you do the corrective action, a gap, the corrective action. And so we've got enough for 4 there. And then as we scroll down, we have slots for the access and functional needs, communities of focus, vulnerable populations, gaps, corrective actions that local public health CHBs need to complete here. And so there's 2 for sure, but you can, as we scroll down a little bit more, add more. If you elect to do all 4 of your gaps in this area, that would be fine too. So you can add additional ones here. And then finally, I think this is the last, this is the last duty under capability 3, revising plans. So you need to update plans, policies, or procedures based on corrective actions identified. Revisions must reflect procedural or policy level changes that need to be made to the plan. And that's why we're asking you to just work on 1 plan. You can work on more, and we've got room for you to do that, to add in more plans, but we recognize that procedure and policy level changes can be a big lift. And so to work on just 1 plan. So we ask you to list which plan you're revising, and then list an item within the above plan that has been revised. And then you have the option to list additional items within the plan that you've revised, up to, I think, 5. And then you'll see at the very bottom there, do you have another plan to revise? And that'll open up the same set of boxes for you to fill in. All right, let's move to the next instrument. All right, we're not going to go through the AARIP because that one's been around a while and you know this one. And then the NIMS ICS one, let's look at that one. So I know for many people, ICS came up as a gap in different ways during COVID. You may have addressed some of those things. You may have identified what needs to be done but didn't have time to do it. Either way, this is where you would start putting this together into a new training and implementation plan and timeline. So we ask you for here to identify 3 gaps in ICS training and list them below. Develop a training plan to address the gaps and share with your PHPC for review. And we recognize that this will maybe and likely will be integrated into the IPP, the Integrated Preparedness Plan. And then we ask that you complete at least 1 of the identified trainings in BP4. So again, you can indicate what level you're reporting on if it's multi-county, multi-agency CHB if you're going to be reporting for each local public health within that CHB, or what other kind of configuration you are, where you're at mid-year, end of year, and then we ask you to identify 3 gaps individually there: first gap, second gap, third gap, and then to provide the name of the training that you delivered from your training plan that addressed a gap. And then you can list the details of the training in the training tab. So go ahead and move to the next one. Yeah, Melissa, yep, plans could be COOP, they could be vaccine, they could be essential services, they could be administrative and fiscal preparedness plan, could be standing up your EOC, your DOC, your Department Operations Center. So there's a lot of different options. We leave it up to you to decide which plan you feel is most highest priority to start revising, because everybody will have a different priority. The recording will be available just as for those who might have joined late, as soon as we've made it accessible. That is a requirement for all of us, that anything we post is accessible. And so that can take up to 2 weeks. We'll do it as quickly as we can, but there's several steps that have to go through that. So we'll kind of refresh that again at the end too. I'm not going to go through the training plan in any depth. It hasn't changed at all from the past couple of years. We still have that, is this a COVID-19 related training, for another year. So you can check that just so we know that that was related to COVID. Let's go ahead and move to the next form. Capability 4, emergency public information, is looking at what social media did you use during COVID and what lessons did you learn, and identify areas for improvement. And we're asking you to describe 3 to 5 lessons learned and areas for improvement. Now, if you didn't use social media for COVID-19 messaging, you say no, and we just ask you why. So then you're done with this one. If you say yes, we want you to describe the up to 3, and then if you've got 2 more or 1 more, you can say yes and describe a 3rd or 4th lesson learned, 4th or 5th lesson learned. And then areas for improvement. Describe an area for improvement that arose regarding social media. So 1, 2, 3, and you can go up to 5 on those also. And then that's that for that one. And again, we aren't looking for bestsellers here. We're just looking for enough sentences that describe it in enough detail for us to understand. So could be 2 sentences, could be 4, but it doesn't need to be long. Next instrument. Okay, so this is around capability 8, medical countermeasure dispensing and administration. And this one's really focused on the capability 9, really, that focuses on moving stuff around, moving your medical materials around. So there's 4 areas. We can scroll down to those. So we've got receiving gaps, storage gaps, dispensing gaps, and administration gaps. And we ask you to share up to 2 gaps in each of the following categories. And if there's no gaps, we'll have you write NA when the box opens up. So describe a programmatic gap related to the receiving of medical countermeasures. You can add another one. And it'll be the same question then for storage gaps. Did you have storage gaps? Do you want to share another gap? Dispensing gaps, do you want to share another one? And administration gaps. So that one's pretty straightforward. Again, doesn't have to be a lengthy explanation, but needs to be enough so that it's understood what the gap is. Okay, next form. Capability 15. So this one, did you use volunteers during the COVID-19 response? If you say no, we'll ask you why. If you say yes, we have a few more questions for you to answer. Describe a lesson learned from using volunteers during the COVID-19 response. And then do you have another lesson learned? I think you can go up to 5 on those. And then we move to areas for improvement. And so you can share areas for improvement. One for sure, and then do you have others that you want to share? And so again, you can, I think, open up to 5 of those if you want, but one for sure, if you used volunteers. All right. And then let's see, information sharing, volunteer plans, and activating volunteers have not changed. Those are all the same. Just a reminder that information sharing is bi-directional. So it's not just pushing information out to partners or the public. It's you need specific information from some of your partners. Activating volunteers is actually having them deploy to an assignment. Volunteer plans can be done at the CHB level, and that one really asks about 7 elements that should be included in every volunteer plan. A volunteer plan would be an excellent also one to revise for those that use volunteers and found gaps in your plan. Response and recovery we'll take a look at. We tweaked just a couple things here. So again, if you didn't have a response, you just say no and move on. You don't have to fill that one out. But if you say yes, it does open up to all those questions we've asked. Most of them are radio buttons, so it should be pretty quick to complete. This is all the same type of hazard, but Sean did some magic, and instead of trying to count the calendar days, he now has it self-calculating for us. So Sean, do you want to explain that?
Yeah, sure. So let's say, you select your type of hazard. So let's say your hazard was extreme weather. You would click this. Let's say the start date of your response, we'll just say October 3rd. If your response has ended, you can go ahead and click yes. And then you just select the date that that response ended. So let's say that your response ended a week later on the 10th. If you click that, it will auto calculate to 7 days. Let's say the response hasn't ended for whatever reason, you would click no instead. And we're just asking you to select today's date in this field if your response hasn't ended yet. And you can do that easily just with this today button here. And it will calculate in this subsequent field.
Thanks, Sean. And then if you activated ICS, you say yes, some boxes open up, and go ahead, Sean, and explain that set of.
Yeah, and this is essentially the same thing. So let's say, again, you stood up ICS on October 3rd. If your ICS structure demobilized, you'll hit yes. And you just select the date that your ICS demobilized. So again, we'll just say the 10th. It'll auto calculate. If your ICS structure hasn't demobilized, you'll hit no instead. And again, just like above, we're just asking you to select today's date in this field, which you can do with this button, and it'll auto calculate again.
Thank you, Sean. And, just pick the date that you're filling out the report at the end of the year on this one, if it's still ongoing. And we don't expect you to log back in on the due date of the report to change that if it's still current, just whatever date that you are filling out this report. The rest of it is pretty much exactly the same, I believe. So we just change language to not used for the forms. If you used anything once or frequently, you'll be asked, was it useful or not, and why or why not? So keep scrolling. And then what role was it useful or not? And then you can put in some comments, again, just brief comments. Roles in the doc, which ones you filled in your department operations center, if any. And if you had an EOC, did public health fill any of those roles and which ones? And then which departments you've engaged. I did a survey of websites to see how everybody named their different administration departments and divisions, and did a crosshatch of those. If you don't recognize or you worked with somebody who's not here, you can click other and fill those in. We did add library because library came up several times in some reporting you've done. So you can then list what other departments, divisions, or entities you worked with that were part of your jurisdiction's governmental offices and work. Communication activities, we made just a few little tweaks. We, for social media, when you click that one, we've now created a drop-down list instead of you having to fill that in. So you can just check those boxes. If there's anything we missed, you can click other and type in what type of social media we missed. When you, we've added through trusted partners, if you use trusted partners to communicate, and that opens up a box to ask you to identify which trusted partners you worked with. And yep, that's that for that one. And then under the hotline one, whether you check public, provider, or both, we have a box that opens up and asks, how did you staff it with local public health, with volunteers, or with others? And that could be one of your creative innovation, impactful. Maybe you use library staff to staff your hotline. It's kind of creative. Maybe you used some other method to staff that so you could free up public health staff to do the kinds of things only they can do. And then we added in under how do you communicate with partners, we added in-person meetings back in. As we know, people are meeting in person again. But we left the video conference calls, audio conference calls, health alerts, and emails. And then you can always choose other and type in other ways you communicated. And then finally, again, we've asked if you used risk communication principles. All right, let's go to the next one, Sean. And community engagement is pretty much the same. We did change Latin X to Latin A. So the E at the end instead of the X, as we understand that that is the correct terminology to use now. And so you can check any and all. So if you check one, I believe it asks you. So yeah, that's the sector one. So again, the types of visits or activities you performed with them. I'm not sure if we had recovery in last year, but it's in here this year for sure. And so however many you've selected, it will fill in community leadership. And then if there are cultural groups you've engaged, not as part of working with CCCs, do you want to check one of those, Sean, please? Yep. Okay, so nothing opens up there. So you just check which cultural groups you've engaged with. And then when you do get to the did you work with any CCCs, if you say yes, it'll ask you which CCCs you worked with, which target populations you worked with them with, and then what work did you do with the CCCs. Sean, if you check no, does anything open up? Yeah. Nope, it doesn't. So then you're done if you didn't work with any CCCs. And then finally for partnership engagement, and this was last year too, were there 2 or 3 partnerships that helped make response better, and were there 2 or 3 partnerships that made response work more challenging? And then did you have any partnership gaps that you had to rapidly fill? If you say no, I think that's it for you. And then if you say yes, there's just a couple more. Please describe the gap and reasons you need to rapidly address them. And will you work on developing these partnerships moving forward? If you say yes, you're done. But if you say no, it does ask why not. And then you're done with that one. And then I think we have one more. Our final one. Now we pulled the PHEP funding for COVID activities out of the vaccine grant reporting. Last year, we just were unable to integrate it into REDCap at the time that they were wanting to collect this information. But this year we were able to integrate it here. So it's the same questions that you were answering on that report. They're just in here, and so they'll be part of this report now. So we did add, if you say yes, we ask you to describe the activities, list and describe the activities occurred. We did pull apart promoting vaccine confidence and decreasing vaccine misinformation. Those are two different things. So you can talk about how you promoted vaccine confidence and how you decreased vaccine misinformation. And then at the bottom, supporting non-Copewell related staff recovery efforts. We know that not all the recovery efforts around mental behavioral health are Copewell focused. So if you did, and you say yes, we'll ask you to list and describe your staff recovery efforts. And then if you say yes to ongoing community recovery efforts, we'll ask you to list and describe those. So those are our instruments forms for BP4. Sharon, let me talk with the staff. Let me talk with the staff because we've not asked you any information much really about COVID-19. So I think if you had one in BP3, we don't have that information anywhere else that I'm aware of. And so it just maybe if you used a call center during COVID, so it could go back to January of 2022 or whenever you stood up response, if it was February or March or April. If you stood up a COVID call center in this case, if it's a COVID related one, that response and recovery tab can be used if you're responding to monkeypox, if you're responding to measles, a wildfire, all the many different disasters we have occurring. So, it depends what particular response you're working on. If it's for COVID, you know, go back through the response, the entire COVID response. But if it's for a response that's occurring in budget period 4, then you'd use that for that response. Does that make sense? Yeah. Yeah. We waived the duties last year. So a lot of these questions actually were for last year. And so for COVID response, and that's what we said at the beginning, and I don't know if you were here, but go ahead and reflect back for COVID response, the entirety of that, January 2020 to June of 2023. Hopefully we'll be done with COVID, active response by June of 2023. But some of these duties are specific to work you do in BP4. So if it's a COVID question, go ahead and go back. If it's related to work you're doing in BP4, and you can always ask us. Other questions? Got 4 minutes left. Okay. If there are, I'll give it 1 more minute and then we will close. We will, as I mentioned before, this has been recorded and we will do all the pieces to make it accessible as fast as we can. I guesstimate that 2 weeks, but we will try our best to do it sooner. But it's not all dependent on us. There's communication office pieces too. So depending on where their staff are at and what they're doing, it can take a little bit of time to have some of the pieces in place. But we work it as fast as we can. So we'll get it posted on SharePoint under duties and supporting documents. We'll let the PHPCs know, and we'll get that posted as quickly as we can. All right, if there are no further questions, I want to thank you all for taking the time to attend today. And as always, your PHPCs are a great first place to ask questions. Anything they can't answer, they move up, and we try to get the answers to you all as quickly as we can. So thank you, everybody, and enjoy the rest of your day and the warm weekend we're supposed to have. Nice way to have